There's been huge momentum the world over at a grassroots level, both in terms of individual health professionals, from doctors, nurses, allied health profession, up to their national representative bodies. We get a huge amount of support from groups like the British Medical Association. At our event in New York, we had the US Surgeon General and the full weight of his office coming speaking about the importance of that. There's a huge momentum growing there. The sense I get, particularly in Lima, is that is beginning to translate. And often, I think we hear a lot of talk about positive messages that aren't necessarily justified. But I think as we arrive at Lima and as we move on to Paris, you get the sense that the political landscape has shifted. There's a Lancet Commission coming up in the next 3 to 4 months on climate change and health, and one of the recommendations that it has there is that a key way to make sure that health is considered is through health impact assessments. And this is by looking at the mitigation technologies and interventions that we choose to pursue, and the same on the adaptation side, and assessing what are the health impacts of these interventions. How do they either improve and benefit public health, and if they do, how can we increase the amount that they improve public health, or how are they potentially detrimental, and how do we reduce that risk? If you can start to get that to be a systemic thing, every time we build a new energy system, every time we look to adapt to a particular part of climate change, we consider some of those broader health and social implications of what we're trying to do. You build that in, and then you build in the cost savings around that. I think that would be an amazing way to try and begin to internalize some of the damages that climate change is doing that are currently just entirely unaccounted for.